Most of us will never experience a psychological disorder because for some miraculous way or through some miraculous way, we all end up pretty right. But the chances of us coming into contact with somebody that has a psychological disorder is pretty good. So what is a psychological disorder? There are a ton of psychological disorders, but the one thing that I think you guys need to know about psychological disorder is any time a person's ability is impaired, it causes significant distress or impairs our ability to function in everyday life. That's what makes a psychological disorder. Again, psychological disorders are far and few between. There are very small percentages of people that have psychological disorders because they're abnormal. They are absolutely, positively abnormal. The DSM-5 is what gives us the diagnostic criterion for psychological disorders. The DSM-5 is the American Psychiatric Association's diagnostic and statistical manual of mental disorders. About 250 mental disorders that are listed there with the criterion for diagnosis and the typical course of the disorder. Again, what makes something a disorder? You go back to the chapter on social psychology. Culture makes a psychological disorder. What is normal in one culture may or may not be normal in another. We are getting ready to do major projects on psychological disorders. You are going to get your fill. It is a very good idea for you to read the book and read this PowerPoint and have a general, brief understanding, if you will, of what a psychological disorder is. In the projects, each of you will get in-depth information regarding a psychological disorder. Your classmates will do the same. You will come together. You will present that information to each other through presentations, and you will react to each person's presentation. You are going to get a ton of exposure to what psychological disorders are, what happens again when something goes awry. How do you treat a psychological disorder? I firmly believe that treatment of psychological disorders are best done through therapy and medication if needed. When you have a neurotransmitter problem, you need some sort of medication. It is very important through therapy to have people understand how and why they have a mental disorder and be able to have good hygiene when it comes to personality or any other mental disorder. So therapy and medication is the best way to treat things. Does everybody need medication? Absolutely not. Sometimes you need medication so therapy can start working. Just like you need medication for heart disease or high cholesterol, sometimes you need medication for mental disorders. The one thing that I can say about therapy is when choosing therapy as a treatment for mental disorders, you need to make sure that you are with a therapist that makes you feel good. Just like you can get a doctor that you are not jiving with, you can get a therapist that you don't jive with. That doesn't mean you give up. You get a second opinion. Last thought, you wouldn't go to a podiatrist for a heart problem. Remember that when choosing a doctor for a mental disorder. Please, please, please choose somebody to help you that is an expert in the field. If you ever in your lifetime think that maybe you or someone you love would have a mental disorder.